Okay, I'll try calling MSP again. It's to find out what they think I owe and why, so that maybe I'm not going to be too pissed off if I do my taxes and only get a partial refund until we do a bigger audit of how much the CRA really does owe me. 1-800-663-7100.
Thank you for calling Health Insurance BC. It is important to keep your MSP account up to date. This includes notifying HIBC if your address changes. For more information, or to update your account, please visit gov.bc.ca/managing your MSP account. For services in English, press 1.
Punjabi ਲਈ 2 ਦਬਾਓ.
Okay.
Your call may be recorded for quality assurance and training purposes. During this call, Health Insurance BC may ask for and collect personal information. The next message provides more detail. To skip this message, press 1. For our website, press 2. If you are calling on behalf of another person, please note that the account holder will need to provide consent in order to discuss their account. We require written authorization on file prior to proceeding, or the account holder must be on the line to provide their verbal consent. For self-service options, such as checking for active coverage, our appeals process, or supplementary benefits, press 1. For medical services plan, including BC Services Card, retroactive premium assistance, or the International Student Health Fee, press 2. For pharmacare, press 3. To make a payment for an outstanding MSP premium or International Student Health Fee, press 4. To repeat this message, press pound.
I'm going to go 4 because I think if they think I'm making a payment, it'll get them on the
Please
phone
hold
sooner.
while we transfer your call to Revenue Services of BC.
Thank you for calling Revenue Services of BC. Our hours of operation are Monday to Friday.
Oh, wait.
8:30 a.m.
They don't
to
know
4:30 p.m.,
the details, and that's what I want.
excluding
I didn't know
statutory
it'd be transferred.
The Ministry of Finance fosters a respectful workplace, and we appreciate your cooperation in this regard. Please note that staff may end any calls in which disrespectful or abusive language is used. This call will be recorded
not
for
long,
quality
though, I'm gonna
assurance
ask
or
questions.
training purposes as authorized under Sections 26.c and 26.e of the Freedom of Information and Protection of Privacy Act. Personal information may be collected for the purposes
God,
of
it's long.
administering revenue services. If you have any questions regarding the collection or use of this information, please speak to the agent on the line. If you would like to make a payment using our self-service option, press 1. Please note, agents are not able to process payments. To speak with an agent, please stay on the line.
For how long?
If you are calling regarding MSP enrollment, coverage changes, or coverage of an international student including updating a permit status, press 1 to be transferred directly to Health Insurance BC. To speak with an agent regarding
I
your
should do
account
that, though.
balance or other billing inquiries, please remain on the line.
Okay, I'm going to transfer back to where I was
While I transfer your call.
because I want the details of what they think it is for what
To be
year.
eligible for provincial health care benefits, all new and returning adult BC residents must register for the Medical Services Plan and obtain a BC Services Card. If you are a new or returning adult BC resident, go to gov.bc.ca/BC Services Card for more information. To continue, please hold. During this call, Health Insurance BC may ask for and collect personal information. The next message provides more detail. To skip this message, press 1. For our website, help us deliver a great service by filling out a short 5-question survey after your call. Simply stay on the line after the agent finishes the call to complete the survey.
Should I trim all the waiting time in case anybody wants to view this, or should I make you go through it, which will make you not listen to the end, which is probably the best part when I get somebody on the phone. I'd like to know what the waiting time is, please.
Our agents are assisting other clients. All calls are answered.
You know what
in
I'm
the
going to
order in
do
which
is I'm
they
going
are
to go to
received.
Service BC next
Information
week
and forms are
and
available on our
record with my
website.
phone.
Please visit
Just put it on the counter and record as I'm talking to the person.
www.hibc.gov.bc.
The rule in Canada is one person must know there's a recording. And I know, right? But the thing is I don't mind saying, especially when they get problematic, I'll say, you know, I'm recording this for quality purposes, quality assurance, and for training purposes. Now, if I go to Service BC, they should be able to dig up the information about why they believe that, and then they'll say, oh, it's too late to contest it, and I say, oh, well, it's too bad. You should have informed me before, or tried to, email me or something like that. I don't use my self-serve or my account because it's been problematic, and I've done a lot of videos to explain and demonstrate why. So for me, who values my time and doesn't want to partake in this, violence against my own identity or time or incompetence on their part and kind of have them waste my time because of it, I'll just document things, and if it ever escalates, then I dig everything up.
Calls are answered in the order in which they
Emails,
are
videos,
received.
YouTube links,
Information and forms are available on our website.
screenshots, and
Please visit
say, well, these are my efforts, Judge. Can they demonstrate their efforts? Because if you only go on their side for it, because they're the authority in this case, and you identify with them, Judge, and what you're doing is that you're ignoring evidence of their incompetence when I try to contact them or resolve things. And when somebody wins a case like this, and then with this argument, and CBC hopefully covers it, then the government are going to say, that's a valid... If a person tries and tries, it's a valid argument that not only did we not resolve this in time for them, but we have to compensate them for all the hardships, such as not getting dental care I can afford, because I can't do my taxes without being worried about being robbed by one government or another when I want to audit it and take them to a transparent forum and have them answer my questions. Why they think that, and why they think that I should just pay because it's easier for you to close your file. No. Oh.
You know, it's monitor BG. My name is Howie. How may I help you today?
Oh, hi. You said your name is Howie?
Yes, indeed.
Okay. I got a letter from BC Revenue Services that says I owe money that I know nothing about, and it's related to MSP. Are you MSP?
I am.
Okay, so can we go in my file and find out why this is? Because they're actually trying to scam both myself and the Canadian government out of this money that I have no clue what it is and if I agree with it or not, and if it's accurate or not. Because what they did is, even though the BC government knows my address, for example, from my driver's license, is they sent a letter to my brother, who eventually found it in his drawer and scanned it, and it says that they would hold money from me doing my taxes with the CRA. But the thing is they don't even tell me. They don't even contact me. They just send the letter somewhere else to try to get away with stealing this money when I do my taxes, and they don't inform me about it. So that's not okay with me. But I also want to know what this is about, because I've been a poor person in BC for so long. There's no way I would owe money for MSP. And actually, there are ways that I'm supposed to be reimbursed for medical expenses that I haven't been by the province. So do you want my care card number?
Yeah.
Care card number? Or?
Yes, please. Your home address, including city and postal code, please.
Okay, so I want to verify that you have it. So I'll give you part of it. It's in Prince Rupert. Do you know my address in Prince Rupert?
Yeah, I can see that here. I'm just gonna verify you right now.
Okay, so can you give me the avenue, and I'll give you the rest?
Unfortunately, I can't do that. When we do verify, you have to verify me.
Can you give
all the
me your
information
postal
that
code?
I-
Can you give me my postal code?
No.
Okay.
You have to give me those information again.
Yeah, and
Once
you do.
we've
Okay,
completed the
so you'll have to
verification,
verify me another way
answer.
because I'm trying to verify that you do know my address. And if you won't, work with me on that, then please choose a different verifying question for me.
What is your previous address, perhaps, please?
I've lived in a motorhome for a while. I'm not sure, like years ago. Like years
When
ago.
you look at your BC service card, what is that address that shows in your BC service card?
Well, it's my Prince Rupert address. It should show.
Okay, can you give me that address you're looking at your BC service card address?
Okay, do you understand we already went through this? I'm trying to find out if you guys know where my mailing address is so you can mail me instead of my brother in Quebec. So I already gave you the city and you said that's right. Yeah. So that means we're probably on the same page.
We are in the same page, Martin. So what I'm doing now, in order to answer any question that you may have for me, I must verify you first. So I asked you personal health card, you gave it to me, that's one, and then you gave me your full name and your date of birth. The question I'm asking is, if you look at your BC service card or a driver license, there is the address. Can you give me that address?
Driver's license? You want the address on it, or you want my driver's license number?
The address.
Okay, well, so we're stuck in the same loop. Now, before we were trying to get out of this loop, and you were asking me a previous address, so I can give you some from years ago where I was there long enough that you would have them. For example, 1101 Chemainus Road. I lived there for like 8 years.
Do you have any ID in front of you right now, Martin?
Yes.
Look at that ID. And what is that ID it shows in the address? It shows an address, any ID, BC ID or driver license, BC service card.
Yeah.
We have address on that card. Could you please give me that address, please, to confirm it here with me? Thank you.
Okay, I'll give you the address. Okay, but I just want to say that I find you abusive because you're insulting my intelligence by going back to the same thing. I'll give it to you, but I find you abusive on record, okay?
Thank you. Do you have a spouse or children?
No. It's strange you ask with that tone.
And it's just one more question, if I may. Your status in Canada, are you Canadian citizen, permanent resident, or temporary document holder?
Well, the same as before. I was born here, Canadian citizen.
Thank you. Now, when I am looking at your account here, I see the Prince Rupert address.
Pardon?
And the address, the Prince Rupert's address, we have the correct address on file.
Yeah.
Same address that you provide me shows the same here in the system. I just want to let you know that. And regarding the invoice that you receive, and your brother received that invoice in Quebec.
Well, it's not an invoice because it has no information other than an amount. The amount is 600 and something, and I don't know what it's about. I know I've always been poor, and I know that I actually am owed money by, the health system, not the other way around. So I want to know why you guys think I owe you 600 and something dollars, and you want to take it out of my taxes.
Yeah, okay. I just noticed here Martin, it looks like the total balance on account $637.50. That's what I'm looking at in the total balance here in your account. Let's look at this. What it is. One moment. Let's see on this one. See, that might be the case previous.
Now, if the call is cut off, do you have my number to call me back?
I sure do. May I confirm that number with you? 250-600-1195.
Now, do you have it from the call display? Do you have it from the call display?
When you call, right, we'll be able to see your phone number.
Okay, so yes, from the
I'm
call
looking at
display.
that.
Okay, so make sure that you write it down on a piece of paper and call me back if it gets cut off there.
Okay, I'll do that right now. I'm going to keep it here. Save that number.
It's possible this $600 is from a long time ago. I don't think it's anything recent.
Yeah, that's what I noticed. That's what I noticed here.
One of the things I want to be sure that it's not is it's not another province trying to scam British Columbia out of this money. Because I tried to take a hospital to court in Quebec when I was visiting relatives, and my case is not even on yet. They charged me a fee to process my case, but they won't call the witnesses at the hospital. So what I'm worried about is the hospital is trying to get money out of me for things that they didn't need to do. I was there for other things, and then suddenly they think I'm weird, and then they tried to keep me in the hospital. And then I was afraid they were going to do that a long time and bill British Columbia. So if this is related to another province, then we've got a court case against that province, and you guys would be co-plaintiff. So let's find out if that's it. So can you tell me the year? So I would also like to be mailed that information at the address we confirmed related to this amount and all the details about it. Now, if it's not easy for you to find right away, because I do want to walk to the library to get internet, I'd like you to mail me as much of this information as possible so I can cross-reference what this claimed amount of $600 is, and hopefully what you mail me will give me a direct number to a caseworker I can call back after.
Okay, so I'm looking at premium. Okay. Looking at here is 2020.
2020. What?
That's what I noticed.
So can you let me know if it's easy for you to find the information or hard for you to find it? Because if it's hard, I don't want to be on the line this long.
No, I have it all the information here.
Okay.
So what I'm going to do is this is regarding the premium assistance, the retro premium assistance. So I'm going to transfer you to a level 3 agent so you can discuss with them further discussion if I'm level 2, if I may. I'll let them know what you call.
Can you explain what that means, the levels? Is it the ability to problem solve things or dig deeper, or is it related to the topic?
It's related to the topic in deep detail.
Okay, will there be a long waiting period for this person?
It won't be that long. Someone should be there shortly. I'm just going to let them know that.
And then I would repeat to that person that I want all this in the mail, right? As well, right?
No, I'll let them know.
Okay, thank you. I'll wait.
Okay.
Oh, you're letting them know with notes, not with transferring and then putting me on mute and then you explaining it. Okay. So that's what you're doing right now while I'm waiting? You're writing notes for the next person?
Yes.
Okay. Because I don't hear any elevator music, so I'm just doing the narration.
Please
So
stay on the line.
okay.
I'm going to transfer you now. Thank you so much
Okay.
for calling Service PC. I hope you have a lovely day.
Okay, thanks. Bye-bye.
You're welcome.
Help us deliver great service by
So
filling
my
out a
hands
short
are here
5
to show
question
I'm not
survey
hanging up
after
the
your
phone.
call. Simply
I
stay
also
on the
want
line
to say
after the
that when I
agent
said I
finishes the
found her
call to
abusive,
complete
she
the
didn't
survey.
address the matter. Still got room in my storage.
Hi, Service BC. My name is Mary. Thank you. One moment. I'm just bringing up the account here.
So you
I understand that you spoke and you verified with the other agent already.
Okay.
And then, Martin, you have a question about the premium assistance.
Supposedly I owe $600 and some, but I have no clue what it's about, and I'd like the details about it. I don't see why I owe money because I've been poor in BC for decades, so I thought it was free when you're poor, so.
So, the premium assistance. Okay, so back in the day, before 2020, those monthly premiums, they were there, and if your income was below a certain level, you're right, there was no fees. Did you file your taxes though each year that we were able to verify that your income level was below threshold?
I haven't filed my taxes in years, and I have asked the CRA to audit my file to see how much money they owe me. So yeah, no, they owe a lot of money, and I would be able to access dental care, for example, if they would allow me, but they're not wanting to audit my file. They're not responding. It's not easy to reach them. So are you saying that this $600 is based on assumptions? I should pay invoices of assumptions?
Well, everyone before 2020 was billed a certain dollar amount.
But isn't it the BC Ministry of
it
the BC Ministry of Poverty Creation that pays you guys, that department? Like it's never been. I get it. Like I'm on Fair Pharmacare, I think it's called. I get my medicine covered through. Isn't it called Fair Pharmacare or something like that? I don't know. I haven't kept track of all these things for years. I just know that I can't even get reimbursed for traveling expenses when I go get procedures, when they're supposed to, the ministry. So I just
Okay.
I give up sometimes on reimbursements, but I do kind of not want to pay $600 that doesn't come with details about what it's about. So, and it doesn't make sense when you're poor to kind of get BC Revenue Services send letters to relatives when they have the province has my mailing address, just to say that when my taxes are done, they're going to seize this much amount of money. It sounds very scammy.
Okay. So if you weren't filing your taxes, then you would have been billed the going rate for monthly premiums to have a medical plan.
Okay, so are you saying this $600 is somehow a breakdown, and it's going to keep increasing if I don't, every year I don't do my taxes. So, so I would like you to mail me at my address, right, in Prince Rupert. I would like you to mail me the details of all these amounts that add up to $600 something.
Okay, so you've reached the medical plan. I don't have billing information. I have, if you're asking about the premium assistance, but Revenue Services is the place that they can mail you your invoices. Absolutely.
BC Revenue Services? They have the details?
Yes.
Well, that's not what I was told.
That's the billing department. Yeah, that's the billing department.
Are you talking about BC Revenue Services, which is essentially a collection agency?
Revenue Services handles the billing for the medical service plan.
Okay, so I don't know why it was transferred to you, because the lady in level 2 said she doesn't have access to that information, and neither do you. But everybody wants me to pay money, and nobody gives me information about anything. So it sounds like, you know, it's a scam, and I have to report it as a scam to the government. Yeah.
Yeah, I'm trying to help you. I can see that there's a balance on the account.
I've been doing a lot of vlogs on my YouTube in the last couple of years about the failures of Northern Health, and there's many I haven't even posted yet. And somehow the medical system wants money out of me for their failures, and they won't give me details. So it's kind of upsetting, right? It's kind of upsetting that...
If you want the details, you would need to contact Revenue Services, the billing department.
Okay, give me their 800 number, and I'll see if that's the same one that, let's say, was written on the letter. Because when you get a letter, it doesn't say details. It just says that amount.
Sure. And then, so Revenue Services... Let me just bring up this one here.
But you're saying it's starting from 2020, and anytime my taxes weren't done?
No, it's not starting from... No, it's not starting. But in 2020, there were no more monthly bills. Like, the monthly premiums stopped in January of 2020.
Okay. So that affects somebody...
The bill that you have would be for before 2020.
Okay, and is it because, you know, the BC Ministry of Poverty Creation didn't pay because maybe they thought I wasn't? You know, maybe they thought I was dead or something?
I don't have an answer to that question, how you're saying. If you didn't file your taxes, then you would have been billed the premium rate.
Before or after that?
$7.50 a month.
So I'd like somebody to dig into my file and call me back, and also mail me as much information about why you guys believe, from whatever department you think, that I owe you money.
That's the Revenue Services. Yeah. So you're going to contact the Revenue Services. This is the phone number. It's 1-877
Okay.
405 4909.
Okay.
They're open from 8:30 to 4:30.
So not today, okay. And
Monday to Friday. If you want, I can try to transfer the call. You might get through.
well, it's almost 4:30. I don't think we'll get very far. I don't want to do a partial call, right? It'll be, you know,
Totally understand.
yeah, not able to
No, I should
resolve
give
it.
you that option. That's okay.
Okay, so this number you're giving me, though, it's BC Revenue Services. So you're saying that when it reaches that ministry or that level of government, all of the information about how these amounts come to be are in their hands. They should be able to answer me. Even though they don't specialize in MSP or whatever, they should have all the details, say, yeah, this is MSP related for those years. It was calculated this way. It's related to taxes or services or whatever, or what the ministry paid or didn't pay. They should be able to do that, you're saying, when I call them.
They should be. I believe they should be.
Can you give me a quick...
There is an account.
Go ahead.
Fine, I'm listening.
There is an account, you said?
There's an amount owing
Okay.
on your medical service plan account, but I don't have details as to for which month, how much, how far back. There's nothing like that.
Because
That's why
the
you need to
information has
contact
been transferred to
Revenue
them.
Services
They
of
would have
BC.
it. Because it's somehow you guys delete it when you send it over there or something like that. Like, is it that it kind of, the information disappears when it transfers or something?
It's been, well, no, it's been more than 6 years since the program has run, those monthly premiums. And so we only hold records for 6 years in front of us.
Okay.
I don't have the details to go through.
But they will have those details.
They should.
Even
yes.
if they have to
They're
dig
billing
up
you, then
hard
they should.
copies or something or scans. Now let
Billing department. No.
yeah. Now let's say I do my taxes and then what happens next year? If I do my taxes and my income is below a certain amount, did the rules change that I still have to pay some amount of MSP? Because I don't know. Because decades ago, I just knew it was covered from my income being on social assistance. So I don't know like how that's changed. Are you saying that everybody has to pay a little bit now, or some people that are poor based on their taxes, which they will see, the T4 or whatever from the ministry as my income, and a little bit of job here and there once in a while, but never really even approaching, let's say $25,000 a year, Because when I call to say why can't I access the federal plan for what the province won't do, right? The province has repaired the same tooth about 8 times instead of putting a crown, which would have cost less than 8 times fixing the same tooth. So, for example, I was told by the dentist, you apply for the federal, and then I call the federal, and they say you're refused, like we thought you'd be because you haven't done your taxes, and then I don't want to get my taxes audited, and nobody answers from the CRA, or you can't reach them, or eventually it hangs up. So, it seems like, we're getting more and more into being an underdeveloped country with barriers in development. So for me, I just want details, right? If I'm wrong, I want to know, and I want to know how it goes from now on. For example, if my income is never over $25,000 a year, whether I'm a student or not, would I pay anything in MSP right now with how things are?
So there are no more monthly premiums since January 1st, 2020.
Okay, so you're saying that's when the changes were, January 2020? But how does it work? Like, what is the amount, if any? Or everybody pays an amount? Even if they're very poor, there's a tiny amount?
No, it's $0, monthly $0. So the BC government has found a way to have the medical plan work through collecting taxes through the employer's tax, the international student health fee. So they are not collecting monthly premiums from citizens since January of 2020.
Oh, okay. So that means this 600 is entirely the previous rules, and you believe it's medical services in BC. It has nothing to do with when I went to a hospital once when I was visiting relatives in Quebec. Quebec wouldn't have billed BC that tried to get the money out of me after anything like that, right?
I don't know about that. I haven't. I don't know.
Okay,
about
and
that.
I think that's
I
after.
believe these are based off of the premium.
I think that was after 2020, anyways. But okay, so and this will never go away. This 600, it'll always be there. It won't expire after 6 years. But that number you gave me is the only place about the details for it. So, for example, if I get the details and we figure out, oh, I was poor in those times, you shouldn't charge me, then it'll go away. Because it could be on their assumptions of
Well,
what...
they go. Yeah, I mean, that's just like a legal document. They go back after 6 years, right? So you would, I don't know how many changes they can make after the 6 years. You can try.
What do you mean, changes?
Would write a letter. You'd have to speak with the billing department to see what actions you can take to make the adjustments.
Yeah, because...
You've reached medical services plans. I'm here to register you for the MSP. I I don't have the billing details. I'm
Okay.
really sorry.
Okay.
I'm trying to help
Okay,
you.
it's okay. I'll call that other number. But are you saying I am not registered right now, or I am registered? Am I on the new rules right now? You have an account for me?
You have active health care, yes.
Okay, and is it still separated in something that says Fair Pharmacare? I'm not sure, because I'm not sure if some things is everybody or some things is just clients of the ministry.
Yeah, so if you give me consent to check the pharmacare, I'll see if you have an account with that.
Yeah, okay. Because I know my regular medicine is paid, but a couple of times doctors prescribe things that weren't covered, not in their entirety anyways. And for me, I said to the pharmacist, contact that doctor. I need an equivalent of something that is covered by whatever my plan is. I don't know.
Your pharmacare is not working. It's not active, your prescription drug plan.
How come?
So you would be paying out.
No,
Pharmacare is an income-based program. So if you haven't filed your taxes, then.
Okay, but the last time I picked up my regular
discount.
medicine, modafinil, my regular medicine that I've been on for 15 years maybe, is I still haven't paid. So how is that explained?
I'm not sure. Do you have another drug plan? Are you underneath the Ministry of Assistance?
Yes, the Ministry of Poverty Creation. Yeah.
Then they might be the ones who are managing your prescription drug plan.
If you call them, they'll say, talk to Blue Cross. And if you call Blue Cross, they'll say, we're not supposed to give answers to clients of the ministry. So can't really get answers.
I don't know that you're even with the ministry, so it doesn't tell me that. I'm just letting you know that your pharmacare...
Oh, that explains a lot, though. That explains a lot, because you guys would go more by the taxes than just this is a client of the ministry. Okay, but Fair Pharmacare, they relate more to the ministry. Is that the difference? Or Fair Pharmacare is medicine related?
Fair Pharmacare's prescription drug program.
Okay. And they're linked more directly to my ministry account?
Anyone is eligible to apply for Pharmacare, but
Okay.
your taxes have to be completed.
And then what? People fill out a form? It's not automatically with the ministry?
If you're with the ministry, then they might provide you the coverage, but that's a question for your caseworker then with the ministry.
Yeah, and we haven't had caseworkers for decades with the ministry. They stopped doing that. They stopped having individual caseworkers, which is, it's kind of a human rights violation. But so, okay, so it seems like we're going backwards as a society. I mean, it helps people, that do.
You would like to register for Pharmacare, but your taxes, you said they are done or they're not completed?
They're not done, no. And I have screenshots of emails I sent to the federal minister of the CRA. I said, we need to audit my file, this, and then the only email I got back from them is, it looks like the problem's been solved, thank you. It's like, where did this come from? It's ridiculous. What makes them think the problem has been solved?
Once your taxes are completed, you can register for Pharmacare.
Yeah, no, the governments of BC and Canada owe me a lot of money, and I think maybe I'll never get it back, and it's a lot of games where the money has to come in and not go out. But anyways, thanks for your information. But it sounds like I have to start over, as if I'm a newcomer in BC, and I have to go get an advocate or go talk to the Service BC office and say, pretend I'm a newcomer. What do I need to register for?
You
what?
have medical.
Yeah, but
You have medical plan. Your MSP is working.
okay, and I have a driver's license, a care card, and I don't know what else, but it seems like it's not easy for me to get the information. It just kind of feels like I'm a newcomer with new rules that nobody's explaining. So, okay, so anyways, I mean, you don't know about the Fair Pharmacare either. You're saying you don't see me on, but it could be the ministry, because you don't have access to my file with the ministry.
It doesn't show that you have an active Pharmacare account. If you are a member, if you are receiving government assistance,
Yeah.
then they will be the ones to register you for Pharmacare.
So
They will be managing.
Do you have a number directly for Pharmacare or Fair Pharmacare, or there's no difference? It's the same thing. I don't know. Or do you give the General Ministry of Social Insurance number? Is that what you give out for people that want that information?
I'm pharmacare trained. You're speaking with a pharmacare trained agent. So.
Okay, yeah. I don't understand why modafinil is covered, for example. I don't pay with any pharmacist. So if I don't have an account, I don't understand that. Do you?
I don't know. So it could be that the plan through the ministry, they might be providing you coverage for that.
Okay, so that's different than Fair Pharmacare then? I could be under I know in the past, years ago, they said, oh, it's called B or C or A. And I know some things goes through Blue Cross, specific Blue Cross. Some things doesn't. So it's still pretty complicated. And of course, it makes it that it's too much for a person to know what goes where because, we're not part of that information.
Sure. If you're under the Ministry of Social Development, you would fall under a plan of pharmacare that's called Plan C.
C? As in
ABC.
As in Charlie. Okay. And that, so every ministry client is C?
I believe so.
And pharmacists should know this by looking up my care card number?
It is. Is there anything else that I can help you with today? Because I'm not sure if there's your pharmacare is not set up through me, but if you do receive any assistance from the ministry, you need to reach out to them.
Okay, so reaching out to them, last question, I know you're finishing probably your shift as well, is reaching out to them, is it the general number you give out, or do they have a specific number related to this topic?
General number.
Oh, okay, which is kind of almost impossible to use. Okay, thank you, and have a good one.
If you want the number, I can offer it to you, or do you have it?
Well, you can give it to me, but it's a number that, I don't know if you've ever called it. You should try it, as part of research. Is it the 1877, the lot of 80, whatever? Can you give it to me then, and I'll just kind of see if it's the general one?
It's 1866.
Okay.
866 again.
Yeah.
0800.
Yeah, it's the same general number. Yeah, it's almost impossible to get somebody there, and when you do, they don't know and they're stuck and they're frustrated, but they never talk to their unions about it, and then society keeps devolving. So yeah, I won't call them, but maybe I'll go into a Service BC office at some point and say, am I all good, and explain this and explain this. All right, thank you.
Your medical plan is working. All right, you're welcome. Thanks for calling Service BC. Have yourself a good evening.
You too, bye-bye.
Take care.
Please rate your level of agreement with the following statements, using a scale of 1 to 5, where you would press 1 if you strongly disagree, or press 5 if you strongly agree. The agent was courteous.
4. Let me see if I press the button here.
Please rate your level of agreement with the following statements, using a... The agent understood my query.
4.
I was satisfied with the knowledge of the agent.
2. And it's not her fault.
I was satisfied with the time it took to reach an agent.
3.
I would speak positively about the service I received.
2. Of course, I'm a unique case as well.
Thank you for taking the time to complete our survey.
Now, does this survey go directly to her, or it generalizes the information of all the ones that interacted with this? It's important to know, because if it does with that person, and their supervisor says, hey, there was somebody that gave you a 2 for this, and do you need retraining? And the thing is it's the supervisor that needs retraining. It's the people that give her access to things or to information that she could interact with somebody that's a unique case that has more challenging questions. So again, it's a sign of underdeveloped proto-societies that are just trying to solve things that are caused by capitalism by applying capitalist solutions, right?